Texas Health Alliance is part of Texas Health Resources, which is one of the largest faith-based systems in North Texas. They wanted this hospital to be a testing ground for the rest of THR's system, to be able to try new ideas and see if they're practical and see if they're going to work. And because we are a small, tight-knit community, we can make those changes and adapt them quickly. It's not even just technology, which we have an abundance of, but even just ideas or process changes. That we embrace that stuff, and a lot of times what will happen is an idea will come and then we can improve upon it further and to come up with something that's really great. And then in turn, that goes back and flows back into the system. Mission control was an idea that was fostered at Alliance. None of the other hospitals have that. Other hospitals have what they call a transport department because they're not always transporting, they're not always handling calls. What can they do in their downtime? And then it was determined that what they could do is do things that the nurses are doing themselves now and taking time away from their patients.
Mission control is kind of a one-stop shop, so everybody, all calls and everything funnels through us. We've got a motto that if you don't know the answer to something, just call mission control. Our main focus is how is this going to impact the patient. The bottom line, it's the patient, and that's what it's all about. How is it going to better their stay? How is this going to allow them to see us as different and set apart from everybody else?
You know, everyone is hungry for innovation, hungry for new ideas to make things better. So, I mean, that's the beauty of Alliance. The patient's not looking at RTLS. What they're seeing is their care being better. As much as we like having our wow factors, and we have quite a few, they all have a purpose, and that's the key. They all have to have a function that's going to either improve patient satisfaction or improve the ability for our clinical staff to work at a higher level, to work at the top of their license. So they're not bothering with the day-to-day normal tasks that just take up time. They get to focus purely on the patient and making them better.